healthcare.gov was to be the cornerstone of Obamacare. Starting October 1st, people in Wisconsin and 35 other states were to use that website to access a health insurance exchange where affordable healthcare plans would be available. For people who live between 100 and 400% of poverty, the feds would subsidize their costs. Although Wisconsin Republicans were critical of Obamacare, they were going to use this situation to move 72,000 people who lived above the poverty line off of Badger Care and onto Obamacare. That would free the state to focus its resources on people who lived below the poverty line. But the website didn't work. While the Fed scrambled for weeks trying to find a fix, Governor Scott Walker was worried those 72,000 people would not be able to sign up for Obamacare by the end of the year. He called a special session of the legislature to keep those people on Badger Care for an extra 3 months.
Just about everyone out there acknowledges that the rollout of Obamacare has not been as effective as originally was proposed, and that because of that, we want to make sure that nobody falls through the cracks.
As 2013 came to a close, the debate over Obamacare was still every bit as fierce as it was 4 years earlier in 2009, before the law was even passed.
This is what fascism looks like!
Throughout that year, thousands of people had flooded town hall meetings across the state, some in support of and others in opposition to the proposed health care law.
The crowds are running about 9-1 against this bill. People are coming out of the woodwork. This is not AstroTurf grassroots. This is organic grassroots. Citizens worried about the direction of their country, worried about how health care is going to be shaped in this legislation in America.
In the end, every Wisconsin Democrat in Congress voted for Obamacare, and every Wisconsin Republican voted against it. President Obama signed it into law on March 23, 2010. Although it was a federal law, Washington expected states to do most of the heavy lifting, wanting them to set up their own health insurance exchanges and websites and expand their Medicaid programs to cover everyone up to 133% of the federal poverty level. The feds promised to pay most of the upfront cost, but then would steadily shift the continuing costs onto the states. At the time the law was passed, Wisconsin had a Democrat governor and legislature, and they embraced the feds' plan. But in November 2010, Wisconsin residents voted in Republican Governor Scott Walker and a Republican-controlled legislature who were openly critical of Obamacare. Right away, Attorney General J.B. Van Hollen joined a lawsuit claiming it was unconstitutional to force people to buy health insurance.
I've been repeatedly commenting that never before has the government required an individual to purchase something just by virtue of existing under the guise of the Commerce Clause.
At first, the lower courts agreed.
Well, they pointed out that it's not just purchasing something, it's purchasing something again and again and again and again from birth until death. And that's really unprecedented, and that the Commerce Clause certainly doesn't expand that far.
But in June 2012, the Supreme Court upheld this individual mandate, claiming it was technically just a tax. At the same time, though, the court said the feds could not force states to expand their Medicaid programs. All the feds could do was bribe states with promises of massive grants. They promised Wisconsin $2.4 billion over the next decade. However, during the budget debates in the spring of 2013, state officials pointed out the feds weren't even keeping their current promises when it came to health care funding.
Last budget, CMS cut the nursing home rates without any fanfare, without anything. They took a 10% cut in the Medicare program. They don't need oversight.
So there is a history of promises not delivered.
There's a history of the ability to impact us pretty negatively.
Wisconsin became one of 25 states to reject the Medicaid expansion. And of those states, only Wisconsin would be covering everyone up to the poverty line, eliminating any coverage gap. Wisconsin also decided it didn't want to set up and run a website and insurance marketplace on behalf of the federal law. The feds would have to take care of that in Wisconsin. That website, healthcare.gov, was to go online on October 1st. Until then, no one would know for sure how much Obamacare plans would cost. But experts were beginning to draw some unpleasant conclusions. Throughout September, Wisconsin's Office of the Commissioner of Insurance held informational meetings around the state. Officials explained nearly everyone could expect higher premiums under Obamacare. The younger and healthier the person, the higher the increase.
Going forward, insurers for this first year are required to have an open enrollment time between October 1st and March 31st. Unless that changes, and we're not anticipating it will, you need to purchase coverage or you may not be able to purchase it at all after March 31st.
The actual insurance companies that would be offering plans on the exchange was also released in September. Even though the exchange was meant to foster competition, it was discovered many counties would only have a single company selling on the exchange. The feds were offering loans for health insurance startups to increase competition in the exchange. A liberal grassroots organization created a health insurance co-op and received a $56 million loan. But then it only offered plans in counties that already had 3 or 4 companies selling insurance.
That's a large chunk of Wisconsin, because remember, southeast Wisconsin has 65% of the population of the state. So you go up north some more, and I lived up north for 22 years and worked that territory. You're getting to a lot of open land and not as much population.
Then there were grants that would go to organizations to help people sign up for health insurance. But much of that money went to groups that had nothing to do with health insurance, like a housing advocacy group in Sheboygan and a law firm in Milwaukee. On October 1st, the big day had arrived. Healthcare.gov launched, crashed, and burnt. In the first 24 hours, a total of 6 people in the entire country managed to sign up for insurance using the site. At the same time, millions of people around the country were receiving letters from their insurance companies informing them their current policies would end on January 1st, even though President Obama had previously promised people would be able to keep their plans under the new law.
No matter what you've heard, if you like your doctor or healthcare plan, you can keep it.
We think that a lot of people who actually received cancellation letters are in the situation where they're anxious to get a new plan. They have been kind of locked in the individual market because of a pre-existing condition, because of pricing, and they are eager to have a plan with full benefits.
As the controversy raged around the country, the Secretary of Health and Human Services, responsible for the rollout of Obamacare and its website, Kathleen Sebelius, visited Milwaukee on Friday, November 15th. She took a couple swings at Governor Walker for Wisconsin not making a greater commitment to Obamacare, even though the law was struggling as she spoke.
In the future, we think that a lot more states will choose, as this law progresses and the market stays robust, to actually run their own sites. We'd love to do that. I'd love to put the federal government out of business quickly, because I think state-based insurance is better run at the state level, and we're hoping that more states will take a look at that option and we can kind of pass the baton to them.
The 2,700-page law had resulted in 11,000 pages of additional regulation. It was estimated to cost at least $1.8 trillion over the first 10 years. And in Wisconsin, less than 900 people had signed up for Obamacare. That's when Governor Walker called for the December special session.
It has become abundantly clear that the rollout of Obamacare is failing, and because of that failure to be at the pace that the President's administration has communicated consistently to this state and to other states across the country, we're going to take decisive action to make sure that the people of this state, particularly people in need, do not fall through the cracks.
That special session kicked off on Monday, December 2nd, when the Joint Finance Committee approved Governor Walker's plan. Both the Assembly and the Senate plan to vote on it before Christmas. For the MacIver Institute, I'm Bill Osmolsky.